Brianna, and I'm going to be performing a cardiac assessment today. I'm going to be your nurse. In real life, I would not be performing this on clothing, but on bare skin. Can you please tell me your name and your date of birth?
Israel Ramirez, July 16, 1977.
And what month is it?
November.
And why are you here?
Heart.
And do you have any difficulty breathing, chest pain, or shortness of breath?
No.
I would first be assessing the patient's skin color, noting his color, if it's appropriate to ethnicity, which for him it is. I would note any paleness or blueness, which are signs of poor circulation. I would then be palpating his skin. It's warm and dry, which it should be. Assessing for capillary refill, that it's less than 2 seconds, which is a sign of appropriate circulation, and any signs of clubbing, which he has not. And if there was clubbing, it'd be signs of hypoxia. I would then be looking at his conjunctiva. They are pink and moist. I'm going to have you turn your head that way, and I'm going to palpate for his carotid arteries. There's a strong pulsation, and his arteries feel soft and pliable. Other side, please. Strong pulsation. Looks straight. And then I'm going to be listening with the bell of my stethoscope for any breweries. That way, please. And the opposite way. Okay. I'm going to have him just lean forward at 45 degrees, and with my pen light, I'm going to assess for jugular vein distension, which is a sign of heart failure or fluid overload. Again. No signs of it. I'd be then looking at his, just the openness of his chest. I'd be looking at the point of maximal impulse, which is the 5th intercostal space and the left midclavicular line. And I feel a thrill. And then I would be assessing his precordial landmarks, which the first one is the aortic valve, which is at the 2nd intercostal space to the right of the sternal border. And then the pulmonic valve, which is at the 2nd intercostal space left of the sternal border. Erb's point, which is the 3rd intercostal space to the left of the sternal border. Tricuspid valve, which is the 4th intercostal space left of the sternal border. And the mitral valve, which is the 5th intercostal space to the left midclavicular line. Then I'd be assessing with the bell of the stethoscope for any murmurs at those same landmarks. Thank you, Mr. Ramirez, and this concludes our cardiac assessment.